Hello, I'm Dr. Ella Harrison. Meet ein Paranisten.
When I first met Mr. Park, I believed his case might be unusual. But just a few weeks later, I met another patient who made me realize that this problem was far more common than we think. A 68-year-old woman named Kim Mi-sun, who lives in Incheon with her son, walked into my office looking completely exhausted, like someone who hadn't slept for months. In a quiet, hoarse voice, she said, "Doctor, I wake up 2 or 3 times every night. Some nights, I wake up more than 10 times. I don't even know if I'm sleeping or just lying there." I asked her what woke her up. She hesitated, then lowered her hand toward her legs. "They itch. Sometimes they feel warm and tingly. When I scratch, it feels better, but then it takes a long time to fall asleep again." The moment she said that, I almost knew the cause. I asked her to roll up her pants slightly. The skin on her shins and the tops of her feet was cracked into tiny fragments, severely dry, peeling like scales. What surprised me even more was that she had no idea how serious it was. Many older adults in Korea live in extremely dry winter environments, running heating systems all night. Even when their skin loses large amounts of moisture, they assume it's normal. They never consider that skin dryness could be destroying their sleep. I explained to Ms. Kim that the skin is the largest sensory organ in the human body. When the skin becomes too dry, sensory receptors become hypersensitive. Even tiny changes in temperature, pressure, or friction are transmitted to the brain. The nervous system interprets these signals as mild warnings and pulls the brain out of deep sleep to check the situation. Neuroscience research shows that when skin moisture drops, sympathetic nervous system activity increases. As a result, nighttime cortisol levels rise. And cortisol is the natural enemy of melatonin, the hormone that enables deep sleep. When these two processes happen at the same time, continuous sleep becomes almost impossible. Ms. Kim sighed and said, "So I wasn't sleeping because of my skin. I thought it was just old age." I nodded. Many people think exactly the same way. They try sleeping pills, herbal teas, aromatherapy, but the real root of the problem lies elsewhere. A noticed skin stimulus is waking the brain. I opened a drawer and took out a small container of petroleum jelly. She looked at me in confusion and asked, "If I apply this, will I really sleep better?" I smiled and replied, "Yes. The effect is much bigger than you think. It doesn't work like anesthesia, but from a sleep physiology perspective, it plays a very important role." I explained carefully. "Before bed, wash your feet in warm water, dry them completely. Then apply a thin layer of petroleum jelly to the soles, especially the central area where capillaries and nerve receptors are dense. After that, put on thin, soft socks," she immediately asked, "only on the soles. What about the rest of the legs?" I explained that the soles of the feet are one of the most active areas for temperature regulation. They play a decisive role in sending sleep signals to the brain. When this area is kept warm and moisturized, biological rhythms reset, and excessive stimulation of skin nerves decreases. 3 days later, she called the hospital in a trembling voice. "Doctor, I didn't wake up even once last night. I can't believe it. It's the first time in 10 years. In sleep medicine, we know that when the feet warm slightly, peripheral blood vessels dilate. This allows the core body temperature to fall gently. That temperature drop is one of the strongest biological signals, telling the brain it's time to sleep. If core temperature doesn't drop properly, deep sleep is extremely difficult. No matter how long you lie in bed, petroleum jelly and thin socks act like a small protective layer, maintaining stable warmth in the feet." But the most important change was this: once Ms. Kim's sleep stopped fragmenting, the brain's glymphatic system, the brain's cleaning system, became active again. Studies from Korea and Japan show that beta-amyloid removal increases dramatically during deep sleep. When sleep is fragmented, this system nearly shuts down. That's why so many older adults say, "No matter how much I sleep, I'm still tired. And the more I sleep, the more forgetful I become." When Ms. Kim returned a week later, the change was obvious. Her skin was softer. Her eyes were brighter. Her steps were lighter. She said, "In the past, my head felt heavy every morning, and my heart raced. Now everything feels clearer." I knew it wasn't because petroleum jelly cured a disease. It was because deep sleep had returned, allowing the brain to recover as it was designed to. When a person sleeps properly, memory, focus, mood, and even immunity improve naturally. Korean winters are cold and dry. Many homes run gas heating or warm air systems all night, accelerating moisture loss from the skin. As a result, older adults are easily exposed to skin irritation, reduced peripheral circulation, and nighttime awakenings. Yet most people don't realize that simply keeping the feet warm and moisturized can restore multiple sleep-related biological systems. Watching Ms. Kim improve so clearly, I became convinced once again solving complex problems does not always require complex solutions. Sometimes, we only need to help the body return to the state it was originally designed for. After her case, many patients began asking me the same question. Dr. Yu, can applying petroleum jelly to the feet really change sleep that much? How can something so simple affect brain function? It's a fair question. The method sounds simple, but behind it lies a complex biological mechanism involving circadian rhythm, core body temperature, and nervous system activity. To understand this, we must first understand the three core regulators of human sleep: the biological clock, core body temperature, and melatonin, the hormone that signals rest. In healthy individuals, as light decreases in the evening, signals from the eyes reach the brain. Melatonin secretion begins, heart rate slows, breathing deepens. Core body temperature gradually drops, usually by about 0.3 to 0.5 degrees Celsius. This temperature drop is one of the strongest signals telling the brain it is time to sleep. But for core temperature to fall, blood must move toward peripheral areas, especially the feet and hands. When blood flows into the feet, capillaries dilate, creating a mild sensation of warmth. This is an essential step for deep sleep. However, with aging or chronic stress, circadian rhythm becomes disrupted. Melatonin secretion decreases. Peripheral blood vessels lose elasticity. The body fails to create the temperature difference needed for deep sleep. As a result, even small stimuli, dry skin, slight noises, or cold feet, can push the brain into alert mode. That is why keeping the feet warm and moisturized is not folk medicine. It directly influences the sleep regulation center of the brain. Petroleum jelly forms a thin barrier that prevents heat from escaping too quickly and stabilizes the skin. Thin socks help maintain gentle warmth and encourage blood flow to the feet. This activates peripheral vasodilation reflexes, an essential step for entering deep sleep. At the university hospital where I work, we conducted a study with 30 patients who had mild insomnia. One group followed standard sleep hygiene practices. The second group did the same, but also applied petroleum jelly to the soles and wore thin socks before bed. After 2 weeks, the results surprised everyone. The second group experienced an average increase of 47 minutes of deep sleep per night. Nighttime awakenings were nearly cut in half. 70% reported clearer mornings. There was nothing mysterious about it. Warm feet led to vasodilation, gentle core temperature reduction, and optimal conditions for deep sleep and beta-amyloid clearance. Stable warmth also sends a safety signal to the nervous system, lowering sympathetic activity. Cortisol decreases. Melatonin can do its job. Interestingly, this method is not only effective for older adults. I remember a 38-year-old man, Jung-hae Jun, who worked in finance. He had no skin dryness or circulation problems, but woke up every night at exactly 3 a.m. Tests showed very high nighttime cortisol, classic chronic stress. His sympathetic nervous system was constantly activated, preventing the brain from entering recovery mode. I advised him to reduce lighting before bed, turn off his phone early, and keep his feet warm. 1 week later, he returned looking completely different. Doctor, I didn't wake up at all. My mind feels clear, and my anxiety is gone. His case shows that even slight disruptions, stress, office air conditioning, irregular routines, can break sleep rhythms. Warming the feet gently resets the nervous system and restores the body's natural rest signal. Another important but lesser-known fact is this. When deep sleep continues uninterrupted, the brain's lymphatic system actively flushes waste through cerebrospinal fluid. This is one of the most important processes for preventing cognitive decline. When sleep fragments, this flow slows dramatically, and toxic proteins accumulate. That's why patients who regain deep sleep report improvements not only in mood, but also memory, reaction speed, and focus. Some patients ask, so does petroleum jelly prevent dementia? I smile and answer, no. Petroleum jelly doesn't protect the brain. Deep sleep protects the brain. Petroleum jelly is just the key that opens the door. This method restores natural biological responses lost due to artificial light, stress, dry air, and disrupted routines. Small, mechanism-based changes create big effects because they awaken the body's self-regulation ability. No sleeping pill can replace that. Every time I see patients regain deep sleep, I'm reminded how powerful the human body truly is. Our role is simply to guide it back to its natural rhythm. The rest, the body does on its own. Thank you for listening to this story. If this helped you, please subscribe, like, and leave a comment. If you'd like to learn more about restoring natural sleep, leave the number 1 below. I'm Yuho Jin. Thank you for staying with me until the end. Tonight, I hope deep, calm sleep finds you and gives your body the rest it deserves.